Welcome to the Nurse Edu Network. My name is Janae. In this video, I will continue to review Domain 1 Facilitate Learning for the Certified Nurse Educator exam. In this presentation, we will finish Domain 1. By the end of this presentation, you will be able to communicate effectively to convey ideas in a variety of contexts, model reflective thinking practices, create opportunities for learners to develop clinical judgment, ensure a positive and safe learning environment, model attributes that facilitate learning, develop and maintain effective working relationships with healthcare and education partners, and apply concepts of evidence-based practice and nursing to guide teaching. For nurse educators to improve relationships and communication with students, they must practice self-awareness. They need to examine their thoughts, emotions, strengths, weaknesses, and personal biases. There are multiple ways nurse educators can practice self-awareness. Reflection allows the nurse educator to identify existing attitudes and process their thoughts. Reflective practice can be used to learn from your actions, make informed decisions, and engage in excellence. It can use mindfulness to think in the moment or reflection after the fact. Another strategy is to receive feedback from others, such as other nurse educators. Journaling is another option to reflect on one's thoughts. To communicate effectively, the nurse educator should consider the transaction and message creation using physical space, cultural and society values, and physiological conditions. They should consider physical space in the classroom. It's important to be aware of verbal and nonverbal expressions. In the online classroom, be careful to use proper capitalization. For example, avoid writing in all caps or using exclamation marks because it can be conveyed as yelling. Cultural and societal values should be considered, such as voice pitch, tone, and eye contact. When teaching students that English is a second language, it is important to communicate expectations both verbally and written. Always speak slowly and clearly. Allow extra time for students to answer. Avoid slang. Lastly, it is important to the psychological condition to have a calming environment for the students. The nurse educator modifies communication as needed to ensure that students properly receive information. The clarity of information is important to facilitate learning. Students also take part in the evaluation process to explore actions, behaviors, responses, and decisions. They then examine the outcomes from their actions and make changes as needed. Debrief and journaling are examples of critical reflection. When reflecting with others, students practice being part of the interprofessional team. Self-monitoring can be used to pay attention to actions in the moment and use insights for future practice. Students that use critical reflection are able to clarify their attitudes, relate to past experiences, and the ability to identify the effect of learning on future practice. Nurse educators model critical reflection when they make changes based on evaluations they receive from students. This shows that they are open to the students' views. Nurse educators must model critical thinking for students. Tanner's clinical judgment model can be used to identify the process of clinical judgment for nurses. The first step is noticing, which means students first notice that something is important. For example, the student is aware that hypoglycemia is dangerous. In the interpreting stage, the student has enough understanding of the situation to respond. For example, the student is aware of signs and symptoms of hypoglycemia and interventions to manage hypoglycemia. They take the information from the situation, and in the responding stage, the student is able to decide on a course of action. The student recognizes that the patient may be hypoglycemic, checks their blood sugar level, and gives the patient some juice. In the reflecting stage, the students reflect on the situation and the patient's response to the intervention. For example, the patient felt better and their blood glucose level went to 100. The student realizes that the intervention was successful and will intervene in a similar fashion in the future. The student also feels pride in knowing how to respond to the patient's needs. Other theories that relate to nurse educators being a role model is the constructivism theory. This theory states students learn by observing others and modeling their behaviors. The social cognitive learning theory also states that students learn by observing others. When nurse educators model critical thinking and critical reflection, they reinforce learning. The nurse educator needs to create opportunities for students to develop their own critical thinking skills. By developing critical thinking skills, the student is forming the basis for clinical reasoning and clinical judgment. There are numerous strategies for students to develop critical thinking skills. Problem-based learning involves students learning by working in groups to solve open-ended problems. Concept maps allow for students to organize diverse elements of a topic. Simulation and case studies also encourage the development of critical thinking skills. Socratic questioning involves probing questions to assess the student's thinking. Reflection and journaling also encourage critical thinking. The CI model can also be used to foster critical thinking. Nurse educators can ask students to state it or describe it differently. They then elaborate on it. Lastly, they give an example of illustrate it so the meaning can be visualized. There are numerous behaviors that the nurse educator may exhibit that are uncivil. They may be unresponsive to students or show little interest. Some other examples are being unprepared, challenging other educators' knowledge, weeding out students, setting them up to fail, presenting info too quickly, making unexpected changes, and being rude. Students can also exhibit uncivil behaviors such as talking about educators, cell phone use, cheating, being late to class, rude, or even interrupting the class. There are numerous ways nurse educators can prevent uncivil students. They can give clear expectations and review the students' policies and procedures. Open communication about assignments and grading can be beneficial. A trusting learning environment can also be beneficial. Prior to providing feedback, ensure that the student understands constructive feedback. Provide feedback that encourages students rather than demeans them. When there is a disruptive student, remove them from the class. In the online environment, it is important to maintain a strong social presence. Students look up to nurse educators, and positive relationships can impact their learning. They also learn the behaviors from nurse educators and implement them into their own practice. Some strategies that the nurse educator can use are fostering engagement in learning, have students complete a learning styles inventory, be competent and passionate. Nurse educators that are available to students for one-on-one show that they care for students. They should also be willing to support students in their success. Most importantly, they should be fair and truthful. It is important to develop good relationships with clinical agencies because many nursing schools struggle to find appropriate sites. A good relationship with a clinical site can also enhance learning for the students. Sometimes nursing students are seen as a nuisance in the clinical setting because they require mentoring. A good relationship with a site can prevent uncivil relationships with agency staff. The nurse educator can help the agency to see the benefits of having students. When I was doing my clinical rotations, the nursing students helped administer influenza vaccinations to veterans at the VA. This helped the hospital out significantly. Nurse educators can ensure that they have good relationships with agencies by having effective communication. They should ensure that the agency is aware of the student's goals, competencies, and outcomes. It is important that they are aware of the level of the student's progression, practice expectations, and schedule. I remember when I was a student, the clinical staff did not seem to know anything about my progress as a student. I was placed with random nurses, and my experience largely varied by which nurse I was with. The nurse educator should understand the agency environment and staff roles. Agencies can largely vary, so teaching strategies should also vary. Prior to starting a rotation, students should have an orientation and engage with staff early on. The nurse educator should gather feedback from the agency and make changes as needed. Some evidence-based competencies that the nurse educator participates in are questioning education practice to improve care and instruction, describing education problems, using PCOT format to formulate questions, searching for external evidence to answer questions, using evidence-based interventions for educational interventions, formulating evidence-based policies, and mentoring others in evidence-based practice. In this presentation, you learned how the nurse educator can practice self-awareness to examine their thoughts, emotions, strengths, weaknesses, and personal biases. Ways for the nurse educator to communicate effectively with students. Nurse educators act as role models to teach students how to use reflective thinking and critical thinking. Positive learning environment is needed to ensure students have a safe place to learn. Nurse educators should be competent in evidence-based practice. For this presentation, I used Chapter 16 and 24 of Billings and Halstead, Chapter 1 of Caputi. In the next presentation, we will review some practice test questions for Domain 1.